Welcome to an overview of the SchoolCare Yellow with Choice Fund plan. This webinar will review the features and benefits of this plan. All SchoolCare plans provide the same coverage, meaning what the plans cover for doctors, treatments, and medications is the same. The plan uses Cigna's National Open Access Provider Network across all 50 states. The open access feature allows participants to self-refer to see a specialist and does not require you to name a PCP. Preventative care and certain generic drugs are covered at no cost. The Yellow Plan with Choice Fund has a deductible. A deductible is the first portion of coverage that is paid by the insured at 100% of the Cigna contracted cost. Once the deductible is met, you still have some potential out-of-pocket in the form of coinsurance. During the coinsurance phase, the plan pays the majority of the cost, paying 80% for medical services and 90% of the cost of a prescription, capping at $75 per prescription. The out-of-pocket maximum is the most you'd ever pay out-of-pocket in any plan year. The out-of-pocket maximum is the sum of the deductible and the coinsurance amounts. Aside from preventative care and certain generic medications, all covered medical services and prescription drugs apply to the deductible, then coinsurance up to the out-of-pocket maximum. Once the out-of-pocket maximum is met, all covered medical services and prescription drugs are covered 100% by the plan for the remainder of the plan year. The Choice Fund is an embedded health reimbursement account, or HRA. To activate the account, subscribers must complete a confidential health assessment. Current Cigna subscribers must complete it between July 1st and August 31st. New subscribers must complete it within 60 days of their effective date. Providing biometric information is not required, but it is recommended to know your numbers. By activating the Choice Fund, SchoolCare will provide $1,000 for individual coverage and $2,000 for two-person and family coverage to pay the first part of the deductible automatically.
Any unused choice funds will roll over to the next plan year and can accumulate up to the out-of-pocket maximum.
Let's review further details of the plan. The plan uses Cigna's National Open Access Provider Network. Preventative care is no cost. The Choice Fund will pay $1,000 or $2,000 towards the annual deductible as long as the subscriber completes the health assessment at myCigna.com. The deductible is $1,250 for single coverage and $2,500 for two-person or family coverage. After meeting the deductible, you will pay 20% of medical charges and 10% of a prescription, but no more than $75 up to the annual out-of-pocket max. The out-of-pocket maximum is $2,000 for single coverage and $4,000 for two-person or family. This leaves you with a net out-of-pocket cost of $1,000 for single coverage and $2,000 for two-person and family coverage. All medical services accumulate to this equation, including doctor visits, telehealth, and behavioral health visits. It also includes emergency room and urgent care visits worldwide, tests, labs, and hospitalization. You have 60 combined visits for speech, physical, and occupational therapy. You have 20 visits for chiropractic and 12 visits for acupuncture. Durable medical equipment, including hearing aids, insulin pumps, CPAP machines, all accumulate to your out-of-pocket maximum. Prescriptions apply as well to this equation, and after meeting the deductible, you will only pay 10%, but no more than $75 of the cost of a medication up to the out-of-pocket maximum. Let's illustrate how this works for an individual. The deductible is $1,250. By completing the health assessment at myCigna.com, it activates the Choice Fund of $1,000. That's going to pay first towards any deductible expenses, whether it's an office visit or a trip to the pharmacy for a prescription. Once the $1,000 Choice Fund has been used, the individual is responsible for $250 of deductible expenses. Then, when $1,250 has been met, you've reached the deductible and now coinsurance starts. You will only pay 20% of medical claims, 10% of the cost of prescription, but no more than $75 until a total expenditure of $2,000 has been reached. The first $1,000 has been paid by the Choice Fund, and the second $1,000 has been paid by the individual. From that point on, all services will be covered at 100%. Two-person and family coverage has a $2,500 deductible. The subscriber must complete the health assessment at myCigna.com to activate the $2,000 Choice Fund. That $2,000 fund will pay the first portion of deductible expenses for any member of the family, whether it is a trip to the doctor, a medical service, or prescription. Once the $2,000 fund has been used, then the family will incur $500 of deductible expenses out of their pocket to reach the $2,500 deductible. At that point, coinsurance's charges apply. You will pay 20% medical charges and 10% of the cost of a prescription, but no more than $75 for an additional $1,500 until the family's expenditure reaches a total of $4,000. The first $2,000 having been paid out of the fund and the second $2,000 paid by the insured. Again, after that amount has been reached, all services are covered in full for the remainder of the plan year. myCigna makes it easy to keep track of all your transactions. First, you can log on to myCigna.com and complete your health assessment. Then, click on Claims and Balances to review all the transactions for your family's medical services and prescriptions. You can also call Cigna 24/7, 365 and speak with a phone representative for questions and customer service issues. And lastly, Cigna has a mobile app that you can download to your smartphone and have all the information at your fingertips, including downloading or printing a digital ID card. If you have questions, SchoolCare's website, schoolcare.org, is a great resource for plan documents, resources, and other information, including details about the Good For You Wellbeing Program. This concludes the webinar. Thank you for watching.